To the Committee on the Standards of Quality. As all of you know, the SOQs are our constitutional obligation and maybe the most important thing this board actually addresses during the course of a year. We are thankfully making progress as we get toward the next legislative cycle. And so, we're going to begin the meeting. First, I hope you all have had a chance to read the minutes from the July 21st meeting. And if so, is there either a motion to approve them as drafted or any corrections?
I'll move to approve the minutes as written.
That silence was worrying me, so I'm happy you did that. Thank you. Dr. Wilson, is there a second?
Second.
Oh, I don't even know who to pick. Dr. Duran. Okay. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Okay, Dr. Sale. Oh, excuse me, public comment. Ms. Dean.
All right. Good afternoon, President Gecker, Dr. Lane, members of the board. I think I'm the only public speaker today, and I don't even think I need 3 minutes. My name is Rachel Dean. I am the legal director of the Youth Justice Program at the Legal Aid Justice Center. We do statewide advocacy across a number of issues, but particularly focused on increasing equity in our public education system and on behalf of low-income students. I'm here as a representative of LAJC to endorse the standards of quality that are before the board. They are truly an important set of standards. They have been since they were first prescribed several years ago now. From our perspective, it is important to stay the course on these standards. They really do provide a roadmap for where we can be headed for high quality public education in the Commonwealth. And as President Gecker stated, we have made significant progress. Just this past year, the Fund Our Schools Coalition, which LAJC is a member of, was able to advocate for the standard around specialized student support personnel. And we were able to get that codified through some really great work in the legislature by our patrons and other members of the General Assembly. And we are already seeing that investment pay dividends in our public schools. We knew that was an important investment to make this past year because of the pandemic. Those are very unique and important support positions in our schools. I just saw local news coverage, which was gratifying to see, but also reminded us how far we have to go. The specialist in that article works in Richmond Public Schools and said, due to that new law and the new funding that has come to Richmond Public Schools, I now only need to serve 2 schools instead of 3. And I think that is progress. It is a good thing, but it also shows that we have a ways to go. So we endorse this roadmap, and we ask you to prescribe this set of SOQs once again, send that over to the General Assembly, and let's see where we can go. There are some areas where we believe we could go even further, and we transmitted some of those recommendations via letter to the board. Increasing English learner support, increasing some of those EL teacher ratios, retaining that 4-to-1 recommendation around those specialized student support personnel. There's probably a little further we could go there. And then even scaling up the enhanced at-risk add-on or the equity fund. We continue to see a changing student population in Virginia, as you all know. So yes, we endorse this set of recommendations, and perhaps for next year, there's even further enhancements we could be making for equity and for investment in Virginia's future. So with that, I thank you.
Thank you very much that you're taking the time to be with us. In-person meetings are not all that common. Taking time to come and say I support something is particularly not common in our experience. And so we would have been happy to have you here had you been critical of some of what we're doing. And we certainly understand those places that you want us to add on to, but particularly happy that you are supportive generally of the direction we're headed. All right. Ms. Dean was the only speaker who signed up. Is there anybody else who would like to take an opportunity to speak to the board today, or actually the committee today? I don't see anybody running to the podium. And so, all right, that will close public comment. And we'll move on to finalizing the board's 2021 prescriptions for the standards of quality and preparing for future review cycles. Dr. Sale. Not Dr. Sell? Did I get this wrong?
Yes, and my clicker is jumping us into the future here. There we go. And I will quickly introduce myself. So I am Dr. Leslie Sale. I'm the director of the Office of Policy. And I have the pleasure to be with you all today to help facilitate this last leg of discussion for the board as you all finalize the 2021 prescriptions to amend the standards of quality. The lift isn't entirely on me today. I've enlisted some additional help. Holly Coy, our assistant superintendent, and I'm going to let her to kick off the conversation and set the tone for the meeting, and then we'll jump into the meat of it.
Wonderful. Thank you, Dr. Sale, and good afternoon, President Gecker, Vice President Wilson, Dr. Lane, and members of the board. Delighted to be with you this afternoon as we bring the conversation on these particular prescriptions to a close as you prepare to bring them to the full board, technically, next month. This afternoon, we will cover some technical updates around the funding methodology, as well as some prescription language refinements based on your ongoing conversations, as well as feedback from our instructional staff and from the field. And then we'll wrap our conversation this afternoon with some discussion of priorities within the context of the entire package being evidence-based and absolutely necessary to achieve the high-quality education system that you envision for each and every child in Virginia. So I'm going to turn it back to Dr. Sale, and she's going to walk us through the updates, and then I'll be back with you at the end.
Wonderful. And as Holly mentioned, as she kind of provided a structure of their conversation today, I'm also going to quickly walk through how we're going to tackle this presentation. I want to start by working backwards because I will hand this back to Holly at the end of the conversation to make sure that we are reflecting on that broader and bigger why behind these prescriptions. We heard loudly and clearly from the board last month that this is something that we want to make sure is elevated and center to all of our conversations around the standards of quality. And of course, and regrettably, in some of my presentations, I feel like I was remiss in not making sure that that was centered to the conversation. So we wanted to make sure that we appreciate the importance and value of these prescriptions, and they will be an important part of how we discuss them moving forward. But in the interim, we do have some work to do in this last mile, and that's what I'll be presenting here today. The two pieces that we'll be focusing on, as Holly mentioned, are a technical amendment to our estimate calculations for two of our prescriptions. One of them being the Enhanced At-Risk Add-on, which we also refer to as the Equity Fund, and our Teacher, Leader, and Mentor programs, not mentioned programs, as noted on the slide there. And then we will also be talking about our student support prescriptions. And there's several different prescriptions implicated in those, but we wanted to build on the discussion that the board had last month about reflecting on where we have seen progress already and how we might continue to move the needle and some adjustments we might make in that space, or whether to move forward with those prescriptions as prescribed in 2019 and 2020. So I will begin us with the technical piece and looking at prescription estimates and how we get to those calculations and numbers that you see with the standards of quality prescriptions. And in looking back at all of our prescriptions and with the help of our Office of Budget, we did identify two prescriptions that may benefit from a small adjustment in methodology calculation. The first of which is our Enhanced At-Risk Add-on. I know you know this prescription well, but I will just quickly revisit what this particular prescription is designed to do. And that's really to maximize the additional state funding to those schools and students that need it the most, so in those areas of most concentrated poverty. There are a few different ways that our prescriptions get us there. And you'll see here, it's really about kind of the consolidation and reconfiguration of our current at-risk programs. And then, of course, making sure that we are very intentional but flexible in how these funds are used and designed. The basis for this calculation as it currently exists is around funded positions, and that was because of the link between staffing and student outcomes here. So using those variables listed, the free lunch rates, enrollment, and add-on range, during the re-benchmarking process, we would determine a number of positions that would go to each school division based on this calculation as it exists today. And the current estimate that we have for that with the existing calculation is $77.9 million for the outgoing year this biennium. Similar to our Enhanced At-Risk Add-on, we also identified that our Teacher, Leader, and Mentor program was designed around this position-based calculation. Again, to quickly revisit what this prescription does for us, is really the board recognizing the importance of teacher induction and professional growth programs. And by supporting teacher retention and making sure teachers have an opportunity to grow and thrive and really become high quality instructors in the classroom, we wanted to provide those leader and mentorship opportunities. Again, this is based on having a certain number of leader and mentors based on the level of experience in your schools and divisions. And again, as designed, it is a position-based calculation, which brings us to that $116.4 million in the outgoing year. So because this is position-based, it does become stagnant when you look at the amount of funding that happens over a re-benchmark, or I guess I should say over a biennium budget. So the calculation for these two particular prescriptions happen on the re-benchmarking year. We determine, again, based on those variables, the amount or number of positions that would be going to divisions, but it doesn't take into account the number of students served and the changes in enrollment that we see over the course of a biennium budget. So we wanted to make sure that divisions who are seeing more students in their classrooms are also seeing the increase in funding to support those students via the enhanced at-risk add-on and teacher, leader, and mentor programs. So as noted here on the slide, the kind of two pros of changing this calculation is one, very practically, that it helps us align with the other calculations in our basic aid funding methodology here, which are also based on per pupil amounts. And then, of course, again, as I noted, it allows for more real-time funding adjustments to divisions as we see enrollment increases. And for those two reasons, the staff wanted to recommend to the board this calculation methodology change with respect to these two provisions and prescriptions. I will note that there is a relatively marginal change in the costs when you do this change in calculation. And it's actually a small decrease in the amount of that these prescriptions would cost in the outgoing year. So as compared with the $77.9 million for the enhanced at-risk add-on, the outgoing estimate would now be at $74 million. And for teacher, leader, and mentors, we would see the number from $116.4 million down to $113.9 in fiscal year 22. And again, despite these kind of relatively marginal changes, this doesn't substantively impact the importance and policy changes happening in these prescriptions. It's really just a change in the calculation and funding model there. So Dr. Gecker, President Gecker, this is one of the decision points for the board today. I'm happy to pause here to tackle this as an individual item, or can continue moving forward, and we can take on all of our decision points at the end of the presentation as well.
I think, what's been presented.
Sure, absolutely. Well, while everyone has a chance to digest that first segment of the presentation, we will jump into the second part of this, which is reflecting on our prescriptions related to student supports. And as you all may recall from the last month's presentation, there were a number of conversations around evaluating the progress that we've seen on some of these prescriptions and how we might leverage those existing kind of points of movement to emphasize some of the board's priorities and making sure that we're putting our emphasis and support behind the right things and where we want to see continued movement. To revisit the different prescriptions that are implicated as part of this discussion, the 2019-2020 SOQ prescriptions tackle student support in a number of different ways. We see the board prescribes 1 school counselor per 250 students, 4 specialized student support personnel per 1,000 students, and then 1 statewide work-based learning coordinator and 8 regional specialist positions to support the implementation of the profile of a Virginia graduate. In 2020, we did see some progress made with respect to the school counselor ratio, which is now at 1 to 325 students, which is being implemented in this school year. In 2021, specialized student support personnel positions were created as part of the staffing ratio and the standards of quality, and the ratio was set at 3 to 1,000 students, and that was effective July 1, 2021. And the Perkins Plan, which the board approved last year, will also effectuate the work-based learning prescriptions that the board had put forward. And we are currently in the hiring process for that, with 3 regional coordinators already on staff and 1 state coordinator with the department and additional hires forthcoming. So the question at hand here is given the progress that we've seen made, do we maintain the prescriptions as is? Do we adjust based on the progress? Or do we continue to evaluate and refine? To reflect first on those two student support related prescriptions, which are our school counselors and our specialized student support personnel. As you all know, these prescriptions were first originally prescribed in 2019 prior to the pandemic. And at the time, these were evidence-based prescriptions based on demonstrated evidence that there was really a need to support students outside of the classroom to both enhance their experience and broaden their experience in schools. From the data that kind of informed the board's prescriptions related to specialized student support positions and school counselors, at the time we recognized that 1/5 of students, and that's more than 1/5 of students, which is 22%, have identified as having one or more mental, emotional, behavioral, or developmental issues. Only half of those are receiving support, and many of which of those who are receiving support are happening in the school setting. So again, even prior to the pandemic, we recognized an important and punctuated need to provide these additional supports to students outside of the classroom. In 2019, 1/4 of female students in middle and high schools and 1/8 of male students in middle and high schools reported having suicidal ideation. So again, we're really recognizing the need to provide these additional supports. So, of course, we know these needs and concerns around mental, emotional, and behavioral health were particularly acute as the pandemic and the impact of the pandemic continues to affect our students. And we have seen from Virginia pediatricians in a survey conducted in 2021 that 80% of those respondents had seen an increase in mental, emotional development or behavioral issues over the course of the pandemic. So these trends and patterns and evidence information are really reflected in some of the information we see coming from the field and professional organizations who are providing recommended standards on how to staff our schools. The board has aligned their prescription with school counselors around the recommendation for the American School Counselor Association, which is the 1 to 250. And then the prescription for the specialized student support personnel positions at the 4 to 1,000 are really kind of an amalgamation of different professional associations' recommendations about how to staff on things like school nurses, school psychologists, and school social workers. And so this was a meaningful step to meeting those ratios in a way that aggregates those positions into a single position category. And we also looked at our work-based learning coordinators. So part of the discussion was thinking about, since we do still have a delta in what the board has prescribed versus what's been realized, there may be an opportunity to think about those roles as school counselors or even specialized student support positions as playing more of an emphasized role in the work-based learning space. We do have a work-based learning coordinator prescription, as you all well know, which is currently designed to provide cross-division and regional coordination for our work-based learning efforts at the division level. So reflecting on all of this and kind of recognizing the need and importance of maintaining the school counselor and specialized student support positions, we thought that the space that we might be able to have a conversation about enhancing some additional capacity would really be with this work-based learning coordinator position. And so had formulated a potential alternative to the board's existing prescription, which has the regional coordinators across the superintendent's 8 regions, and looking at more of a division level model, which would establish one work-based learning coordinator in each division to support more student opportunities in the work-based learning space. If this is something of the board's interest to enhance capacity in that space and move to the division level model versus the regional model, it would have an estimated impact of $7.8 million per year compared with the current prescription of $1.2 million. And to kind of synthesize all of this information, I know it feels a little disjointed that we're talking about a number of different prescriptions with a number of different position types and future review cycles to think about how these different positions interplay with one another and how we think about how these services might be coordinated at the division or school level to provide the most effective use of our community relationships and personnel that are based in the school. And with that, I'm going to hand it back to Holly to take all of this and talk to us about how we're going to carry this forward.
Thank you, Dr. Sale. So at this point in the presentation, we're going to take a bit of a step back and take a broader perspective on the prescriptions and articulating priorities within that package. That will lead us to one final recommended refinement to prescription language, and then we'll kind of land on the final package and can then dive into conversation. So I will start by saying that this conversation about prioritization has to be considered within the proper context so that we have a shared understanding about what priorities are and are not. So first and foremost, as you all have articulated them, all of these prescriptions are necessary to achieve the high quality educational system that the board envisions for every child. And it's the totality of the package and the items in their entirety that can effectuate that change in a meaningful way, rather than any subset of 1, 3, or 5 of them. You have carefully woven throughout your conversations together some prescriptions that address some of our most stubborn challenges as a state. And so they have to be understood as working cohesively together. Selecting priorities from amongst them does not equate to a list of only those items that this board believes will have impact or are necessary to achieve that vision. Second, prescriptions are, as you all well know, based on the thoughtful attention, discussion, refinement of this board over the last few years. And so as a collective, you've analyzed the needs and conditions of our schools and students and staff. You've studied the national research and looked at strategies that have a proven track record for effectuating change. And so prioritization is also not a reflection of prescriptions that are any more or less evidence-based or likely to work. And finally, I'll just note that prioritizing prescriptions is a reflection of progress made in these last few years, matched with the pandemic environment that we find students, educators, and schools in the present. With all of that said, selecting a few key priorities is also just a practical reality in a world with limited resources, both human and financial. Implementing the totality of the package in its entirety at one point in time would be monumental for a variety of policymakers, the state budget, as well as local leaders and implementers. And finally, I will just note as we embark on this conversation that given the practical reality of collectively implementing a few prescriptions at a time, the board has a unique opportunity at this stage in the conversation to weigh in on what those priority items should be. And in the absence of that input, others may fill that void with their own preference or ideas. So based on that and the discussion and feedback of the board to date, the prescriptions identified as potential priorities for this cycle are the enhanced at-risk add-on, the teacher leader and teacher mentor program, and then reading specialists. And you'll see the note there on the slide that the first two reflect potentially the calculation changes that we discussed early on. And then there's a note about the reading specialists, and we do have a proposed amendment for your consideration on the reading specialist based on feedback that we have received from our instructional team as well as educators in the field. So I'll cover that next, and then we can kind of circle back to the totality of the package and some of the decision points before you. So what you'll see on the slide here is your current prescription for reading specialists. This is the existing language as is. The proposal establishes a minimum staffing ratios in grades K-5, and I won't read it to you there, but obviously is trying to provide remedial support for those students who most need it. We recognize that the importance of a strong literacy program and the relationship, particularly in building early literacy skills and long-term student achievement and success, is well established. So in addition to core instruction, school divisions can hire reading specialists to support students through Tier 2 and Tier 3 interventions, meaning those services are delivered to the primary classroom, the primary students who need it the most. Tier 1 instructional supports, on the other hand, can involve coaching of teachers on how they deliver that instruction to all students. And so our conversation on a potential refinement will center around those Tier 1 instructional supports and how we provide greater support to the field in a systematic way, not just individualized student supports. Right now, there are no staffing requirements or state level programs that speak specifically to that tier 1 intervention. But we know kind of colloquially in Virginia, as well as around the nation, tier 1 instructional support can be provided by literacy coaches. Now, I should say that term is not well defined in Virginia. There are other states that do have specific licensure and professional credentials for literacy coaches. Some of the examples are cited here. So Louisiana and Tennessee are 2 examples of states that have intentionally adopted models that provide literacy coaching to their staff who need it the most. Recognizing the importance of having coached to provide that tier 1 reading intervention to all students, the recommendation that you see on this slide at the end of the existing recommendation simply notes that the reading specialists may provide tier 1 support to instruction as part of their role. This is not a mandate, but it is indeed sending a signal that this is an allowable use of these funds and these roles. In fact, a very appropriate use of reading specialists. It does not speak specifically to literacy coaches. As I mentioned, those aren't well defined in Virginia, though we use that term with regards to some staff who may be serving that function. So in the absence of that, we simply intended that those reading specialists, which we do obviously have specific professional requirements for, can do that type of coaching and are well equipped to do so. So that brings us to the proposed kind of final set of SOQ prescriptions. What you'll see on the next few slides reflect all of the recommendations that we've brought to you today for your discussion and consideration. And so I will stop there, and we'll be happy to take on those decision points and the conversation around them however you please, President Gecker.
Okay, well, thank you both very much. It certainly is gratifying to have the department so focused on enhancing the work here and trying to move it forward. I would like to say, though, as sort of a preliminary comment, and open it up to the board for comments. A couple of times we refer to the standards as providing a high-quality education. As you know, the constitutional prescription, said the language puts it on the General Assembly to provide a basic education with the, expressed hope, if you will, of a high quality. And the SOQs really, as the board prescribed them, I think represent what we consider to be the base level of education necessary to meet the General Assembly's constitutional mandate to provide a system of free public education from grades K to 12. I don't believe that what the board did and what we intended to do with the standards was to say this is the top quality system we can have, but it is, in fact, the base level for where the Commonwealth ought to be as we move forward. And the proof, frankly, is in the data, right? If you look at the data across the Commonwealth, we have not adequately served a fairly substantial number of our children. And every time I say that, I remind people that, because I remind myself, because it's so easy to get caught in the negative, we well serve a substantial number of our students. The goal is to increase the number of our students that we serve well through the standards prescribed in the standards of quality. And so I'm not picking at the words, but I think it's important as we go through the legislative process and as we go through the public-facing process to understand what it is that this board is doing, what we are charged to do, and that is to provide the standards for the basic free public system of education in the Commonwealth of Virginia. And as I said, I don't believe we're meeting that today. I think this board has been on record as saying we are not meeting that today with the way we're doing things, which is why we came out with the prescribed standards of quality a few years ago. In any event, we do have a few decision points, I guess, in this. And, I don't know how you want to take them up. If you want to take up first, for example, the calculation methodology, your choice as to how we take them up.
Sure. I think we can start and take them in the order that they were presented to you and start with the calculation back from the beginning of the slides.
Okay. I take it that the decision point here is we have it based basically on number of positions. Staff believes that per pupil is more appropriate. Can I just ask one question, then open up to the board? You assume sometimes that the number of students always goes up, but as we've seen, in fact, in a fairly substantial number of Virginia divisions, the number of students actually goes down. Right? There's outmigration, there's aging out, there's not the replacement of the population. The Weldon Cooper numbers show, there are a few divisions, a minority actually divisions that are expected to have any significant increase, and a majority of divisions that are actually declining in school age population. And so I wonder if, that's sort of point A. Point B, from sort of the business perspective of running a division, and this, having some stability in a funding source is a good thing. I think that going to per pupil provides that sort of year-over-year stability that we need to make this work. And like I said, as you all know, I'm not in the education business, so it's a serious question. Ms. Holton.
Mr. President, if I can just tag on to your question, the COVID impact. So I don't actually know what our latest numbers are. I don't know if we know yet because we haven't got our fall enrollment counts yet. But I think there's a reasonable anticipation that overall enrollment may drop temporarily due to COVID. My prediction, based on nothing, is that drop will be temporary, but it may be some years before. So is there any implication for and I wouldn't want school divisions, for stability purposes, you can't let staff go and then have to turn around when we're in the middle of shortage issues anyway. Let staff go because of funding cuts and then turn around and rehire them next year. So I'm not understanding the technical issue well. I'm worried. Would love to hear you address if overall populations go down, does switching from a per position to a per pupil allocation have implications?
I'll first address the question around the COVID impact, and then I'll come back to more of the biennial issue. With COVID impact, certainly there are declines in almost every school division that we've seen thus far. And so if there were, say, temporary declines, a lot of that could be addressed through the COVID funding that's been provided by the federal government to cover those gaps. And so I don't think school divisions will be in a position, at least over the next 3 years, where they would have to eliminate a resource because they could then use the resources available in the American Rescue Plan. On the biennial issue, there's a real policy debate there for the board that we are seeing some school divisions increasing significantly that would need these additional resources and would not have access to them. Meanwhile, you have some school divisions, many school divisions declining, who, as their enrollment declines, would continue to have those resources but would not otherwise have them, right? And generally speaking, the General Assembly, at least through this COVID timeframe and through other certain points in time, have been willing to do hold harmless. And you could certainly make these funds subject to, if the General Assembly felt like a hold harmless was appropriate, these funds could be subject to that in the way that their budget is developed. So my thinking and staff thinking after we debated this at length in-house was that we would rather have the numbers trued up to actual enrollment, but then if there was a need to preserve funds in school divisions, we could continue to do that through hold harmless proposals, but that the standard of quality would actually track better over time. Now, the other thing to keep in mind is this essentially will reset every 2 years, so you're really only talking about an issue within the mid-year budget. One year essentially. And declines, whereas declines are happening in that 1 year time frame, we're not seeing massive declines really anywhere. We are seeing it being massive over a 5 and 10 year period, but not over a 1 year period.
Any comments from the board? Dr. Duran? Not on that specific, but I need your expertise on this issue. Kidding. Go ahead then, and then we'll come back through this.
Just for clarity, and I think I understand this, but then I heard something said Dr. Sell that sounded different, so I want to be clear. For the enhanced at-risk add-on, the calculation methodology, you said by school, and then you said by division, then you said by school. Remind me and remind all of us, with this enhanced change in the methodology, will we be looking at schools or will we be looking at the aggregate data for the division?
And I believe I will pull up the language to confirm, and I apologize if I toggle back and forth, that it would be division level.
That's concerning, I think, for me, is because I feel like there are many schools in divisions, if we look at the division aggregate data, where we're not going to find the same need. If we're looking at the division, I'm thinking of a lot of divisions in Northern Virginia, where we do have many schools that could benefit from this if we were looking at the individual school data. And so that, Dr. Lane, is there any comments on that? I'm really concerned about that because I feel it's an inequity to some schools that are, I could think of many, I can name many across Northern Virginia who have a very concentrated level of poverty and other concerns that would not be identified potentially through this methodology if we're looking at the aggregate of the division, if I'm understanding what Dr. Salda said correctly.
Sure.
And that's really concerning to me that we would continue to build in inequities in that for those schools which would not be, and currently do not, through some of the prior methodologies, received, I believe, the supports that they need.
Going to school level would be a major change to the calculation. So I'm not even prepared to talk about the impact of that, but, and Tom, I apologize if I'm speaking wrong about superintendents here, but I'm gonna say what I think superintendents would say on the whole here. I think most superintendents would prefer the flexibility to receive the funding at the division level so that they can choose to target the resources at the school level they need. Because as you're well aware, there are some schools in a division where they're very high poverty, others where they're very low poverty. The superintendent can make a decision with the board to essentially drive more resources into those high poverty schools and less resources into those low poverty schools if that's what their data calls for. And that flexibility to be able to move resources between schools, I think would be a preference of most school boards.
And I think,
Dr.
go ahead.
If I might, the language in the existing prescription does say just that. School divisions shall prioritize the deployment of additional instructional positions to schools within the division with the greatest concentrations of students identified as eligible for free lunch.
So I guess maybe I'm not clear on the actual literal methodology, but I'm still concerned is, let me ask Dr. Lane or Dr. Sal, will that actually happen? If there is a school division that had the aggregate data for the division level, their free and reduced lunch, let's take that as an example, is very low, but you have a school in that division that's 80-90% free and reduced lunch, but the division level is 20% or less than 20%. Well, how will that be impacted for that school?
So again, the board left a lot of flexibility in how to use the enhanced at-risk add-on. The primary goal of the enhanced at-risk add-on was to drive higher quality teachers into higher need schools. And the way the language is written definitely pushes the school divisions to do that, but it does still leave flexibility for the superintendent to be able to direct resources. And so let's use a school division as an example. Let's say you have two schools with, say, 70% of students living in poverty, but one school's results are far below the results of the other school. That superintendent may very well choose to put more of the resources in the school that has lower results and not have to drive it purely by the amount of poverty within that school because they're using a division-wide ratio.
And that part I agree with and think that's an added flexibility component. My concern is, would that school division even be receiving sufficient funding if their aggregate as a division is so low? So would they even be able to take the funds that they're going to receive and distribute it amongst to that flexibility that you just talked about? That's my concern, because there are some school divisions that have a very low at the aggregate level of poverty level, free and reduced lunch, but then many schools that have very, very high. I can think of many schools in Northern Virginia where many school divisions in Northern Virginia, their overall free and reduced lunch is not that high, but many schools, 70, 80, even 90%. So on the one hand, I appreciate and agree with the flexibility to distribute. My concern is, are those school divisions even getting the proper necessary dollars to be able to do something like that? And that's the part that concerns me when we look at just division aggregate data.
Yeah, and the board has, yes, it makes sense. The board did have that debate a couple years ago when we discussed this. And there is a base allotment that everybody would receive in this, but it's essentially tiered based on the amount of students that you have in poverty. And so if your school division, and I'm not saying Arlington is at this point, but if Arlington were at 10% students in poverty, they would get a lower ratio multiplier, but still would be able to drive those resources that are coming into those higher poverty schools. And certainly at 10% across the board, maybe one or two schools instead of all of the schools would receive some of those resources. Whereas you might be in another school division where 90% of the students are in poverty, they go to the higher tier in the model, and then they can provide those resources to all of their schools. So I think it's tiered well to allow flexibility and still be able to target resources.
One follow-up question, I'm sorry. Does the going to per pupil versus, the proposal, does that have any implications to what those tiers might look like for those schools? And if it is, what are those implications on both sides?
The methodology that's used to determine what tier you're at could change if you went from 1 year your school division was 70% poverty to 30% poverty. That does not happen in the Commonwealth that quickly. So I would not have fears around that. The big adjustment is in that year over year instead of biennial readjustment to this. If one school division grew 1,000 students, that school division would receive more money to address that right away. Whereas maybe 50 school divisions in aggregate lost 1,000 school divisions to counterbalance that. Those school divisions might see nominal increases, and that's more what we tend to see.
And Dr. Duran, if I might, I'll just add that in the staff recommendation, we don't recommend changing the multiplier language that is included in the prescription, which reflects that concentrated poverty that Dr. Lane was speaking to, and accounts for those divisions with more concentrated poverty.
So if I may just weigh in, so what we are not changing anything on this, but I hear Dr. Duran saying maybe we should. And I would love to suggest that we take a look at this, but not this year. That I think, especially given the given that this is a long-standing formula, we are basically rolling into our equity fund the formula calculations that have been used for at-risk add-on all along. That we ask the department to look at: is there a problem of divisions with small pockets of poverty not getting the resources they need to help those students because that poverty is masked by an otherwise less poverty division. But I just think the timing is wrong to look at it now.
Sure. And I appreciate that, and I would really support that if we could look at that long term. But I also agree fully with what Dr. Lane said about keeping that flexibility. It's not about just saying it has to go there, because there are some schools that do have high poverty. It's not to assume that they're not performing well, right? Okay. So we shouldn't assume it in that way. However, my concern is there any inequity in this methodology for those school divisions who have those concentrations of poverty at a school-based level, not so much at the division level? And I'm not sure what the answer is, but maybe is there some middle ground there that we could look at long term? That's my concern. Thanks.
So if we're on to the at-risk add-on equity fund issue now, I'd like to raise another matter on that.
Yep, okay. I didn't know if
Yeah.
Dr. Wilson had come
I'm
into the
sorry, I
file. Yeah, go ahead.
misunderstood.
Go on.
You're fine. Sorry.
No, you're fine.
Right.
Yeah, we'll come back through.
Ms. Dean's very helpful letter from LAJC and the Commonwealth Institute suggests that the percentage bump that's represented by, currently in the at-risk add-on fund, and that we proposed in an equity fund that's to supplement the SOQ baseline for our low-income students, isn't enough. Looking at national research and what's going on in other jurisdictions. If I understand correctly from their public comment letter, they're suggesting that a 35% bump on average is kind of the conservative minimum amount. I'm not clear what our percentage is now. And I think there, maybe because there isn't a single, I'm not sure whether there is an answer to that, but how do you compare what she's saying about the research should be 35% to where we are now? And I know we've talked about this some before, so forgive me if I'm repeating myself. But how much higher does it need to be, and what would it cost to get to what she's recommending?
Kent, if you don't mind coming to the mic, can you remind me of the max tier?
65%.
65. So what the board did is you went into the most high poverty communities. You're giving actually more than the 35% bump as Chestnut letter, and then other school divisions might be less than the 35% bump.
Right.
That's that tiering model.
And what the public comment letter suggests is that our highest bumps are more in the most needy jurisdiction is close to 35%. So maybe the best way to ask my question, Kent, is just, can you respond to that point in the public comment if you've had an opportunity to look at it yet, the equity fund comment?
No, not specifically, but in regards to the max, add-on percentage add-on. Of course, by formula, I mean that's adjustable, that's malleable. With the associated cost involved, I mean that's
Right, but
real-
trying to figure out what it should be. If you want to take a minute to look at it, we could go on to something else and come back to you too, if that's easy.
Well, I think Ken and I are on the same page here with what he was saying is, I think there is room to grow, right? And I think when the board looked at this 3 years ago, certainly you wanted to put reasonability into this.
Right.
And I would say, from my recollection of board conversations, there was some discussion of, let's get it to here and then we'll get it to there.
But that's been 3 years now, and so I'd like to, let's get it to where it should be. And let's have our prescription be where it should be. And I don't remember having in front of us what appears to be good research suggesting that there may be a right number. So either, I mean, and maybe that's not today, maybe that's next month, but I'd love to see an analysis of what would it take to get to where it should be.
Well, and part of the other part of the board discussion is, when you take that 35% into context, you also have to take into context the federal funds that are partially getting us there, because we're already funding.
Yep, I
And
get it.
so when the board looked at that, you felt like you were, and yes, we will bring the research that you've asked, but part of what you determined 3 years ago was that when you look at all of the add-ons that are provided specifically for students with poverty, we felt like we were in the appropriate range. But that doesn't mean there's not room to grow.
Okay, Dr. Wilson.
Thank you. I have just one observation and two questions. The observation, I agree with President Gecker and Ms. Holton's observations about what happens, kind of the unintended consequences, if there are such, as moving from per position to per pupil. So I would like to, at some point, hear what you're thinking as you all analyzed it. So that's a comment. Question, technical. And I'm moving to another area, President Gecker. In speaking about the work-based learning and the use of the Perkins dollars. So I hear us saying that we are, I believe, moving to a division level model and away from, this is a question, a state level model. If that is true, then what is the idea behind the state support? So we made a concerted or a very specific decision around work-based learning support and doing the regional model. So I'm curious what shifted and why do we now see going to division? So that's question one. And then I'll get my second question in. Reading specialists. I think I read here that the presumption is that reading specialists could provide support in a way that a literacy coach would. That seems to be I would caution us to make that assumption because I don't know that it's true. And I think our friends at the ASCD, for example, and, the Virginia Reading Association, it would say something different. So I would just be really cautious about, certainly understand flexibility, but making the assumption that because you teach reading to students at tiers 2 and 3, that you know how to be a literacy coach to your colleagues. So those observations, questions, I'm happy to hear any response that you have. And if it's tabled to next time, I'm fine with that as well.
Sure.
I'm comfortable responding at the onset, and as we've been doing, feel free to enhance and make my response better. On the work-based learning, we still feel like there's a place for regional coordination. This is growing the program. What we've learned in regional coordination, even thus far, and we're just at the onset of it, is that there really aren't enough resources in the school division to enact some of the board's goals around work-based learning. And hearing comments from the board in previous months that you wanted to see more of that actualized. What the regional coordinators would do in this model, where you had more division personnel, or at least a division personnel to lead this work, would essentially make sure that they're approaching work-based learning from a regional standpoint. A lot of times school divisions will make, CTE decisions based on, locality data where really the jobs are in the region. And so we would be able to coordinate regional efforts to bring those resources to school divisions across their area to make sure that they're targeting those experiences in work-based learning that are actually the highest impact and highest wage jobs in that area. On the reading specialist piece, I think it really is about flexibility. We have heard from some school divisions, and frankly, maybe more so some of those school divisions that have less poverty, who have suggested, my reading specialist is doing great work with my tier 2 and tier 3 students. And they are of the quality where we feel like they could also coach their colleagues. And they have a little bit of available time where if they could go into classrooms one-on-one, do some side-by-side coaching, do some peer mentoring, and so on and so forth, we could get more out of our reading specialist program, but right now they cannot. And so we obviously believe that school divisions should tap out their tier 2 and tier 3 resources first. But as there's availability, and if the individual they selected is of the quality to lead that type of professional development, we just wanted to make it available to school divisions.
And Dr. Lane, I just want to be crystal clear on the work-based learning piece, that the regional model stays intact but is federally funded, and that this is an evolution given the perceived need for support at both levels. I think there is a decision point that is baked in there, obviously, right? The alternative being, don't rely on the federal funding for the regional approach. But the staff recommendation that we brought to you was to let that ride and to use the state investment at the division level to make further advances in that important work.
So may I ask a follow-up?
Of course, yeah.
So then, Ms. Coy, we have 3.
Mm-hmm.
The plan is to add 3. I
Mhm.
think I saw somewhere.
Yeah,
In
yeah.
the next.
Building out all
So,
of it.
yeah, and then the final 2, all 8 of those would continue to be federally funded, and we believe that the Perkins plan will support that ongoing.
Correct.
And then this is an additive. Okay.
Yeah, yes. When the board approved the Perkins plan, the big change you made was you created this
Right.
special
Yeah.
state
Right.
set aside.
Yeah, I
And
remember.
we essentially have no other major purpose for that funding at this time.
Thank you.
Mm-hmm.
Dr. Lane, just one other quick point, just for context on the enhanced at-risk formula. Just for context, the current formula, which is different than the proposed formula, is only funded at a range of add-on from 1 to 26% in the current budget.
I'm sorry,
Under
1 to
the
what?
division level
26.
methodology that's been in existence for a number of years and incrementally increased. But compared to the proposed range add-on currently funded, again, some other differences in that methodology is a range between 1% and 26% in the current budget. So that proposed spread in range of support would be much more significant.
The language in the proposed is a 10 to 65% spread.
1 to
So it's 1 to
26 to 10 to
26 versus
65.
10 to 65.
And that addresses kind of Francisco's comment around if you're not as high poverty, do you still get enough? The board set that at 10%.
So if I may, but so why does why is there a suggestion that our max is 35%? Is that just simply an error in the comment from LAJC? Or is that some referring to something different than the 65%?
The research suggests that the cost of a student in poverty is typically
No.
35.
What I'm referring to.
No, I know, but I'm not sure.
She says that Virginia's, the highest in our current recommendation, I thought she said is 35%. That's what I'm referring to. Only the board's most ambitious proposal reaches
Sliding scale.
that amount, 40%, excuse me. Only the board's most ambitious proposal reaches that amount, 40%, and only for the school division with the highest free lunch percentage in the state. But I'm hearing you all say it's 65%, so that's just an error.
Yeah.
And I don't mean to be putting Ms. Dean on the
Yeah,
spot,
I don't
but I'll
wanna
find
say-
her after the meeting and have
Yeah, I
her
don't want to say
clarify.
they're wrong. We'll ask them where they came up with that.
Okay, good. Thank you.
Yes, ma'am.
I just wanted to offer support. Thank you both for your presentations. I just wanted to offer support for the work-based strategy. As a person who just feels that the unfunded mandates around what schools must do, absent support, we have to find a way to not do that. And certainly a regional infrastructure, I appreciate the comments that are made about maintaining that to ensure that districts are in fact thinking about that from a regional perspective. But the idea that we could come, or districts could come close to meeting the requirements, profile of a graduate and all that we expect, and there's not really resources to support it, we have to find a way not to spread people who are already spread so thin to do more without support. So I wholeheartedly want to embrace the fact that there is attention to evolution in an area that clearly needs it.
Any other comments?
Moving on to other issues?
Yeah, we'll move on to other issues, then we're actually going to come back and try to reach consensus on some of them.
Okay, so I have two. One is, I just want to, I think I hear the staff recommending that we stand by our prior prescription of 4 specialized student support personnel and 1 to 250 ratios on student counselors. And I think that's the right position. And so I endorse the board's, the staff's recommendation on that. 2 more things. One is I hear I think I heard a suggestion that perhaps we prioritize certain of our recommendations over others. And I hear that, I feel that. And on the other hand, that leaves out the one we just talked about, the counselors and specialized support personnel, and it leaves out the ELL recommendations. And I struggle with prioritizing, choosing one of our children over another. And I wonder if perhaps the better course is to just not try to do that now. And, you know, at some later point in conversations with legislators, et cetera, we could help folks think through what, I mean, if we're going to speak as a board, we have to speak as a board, I guess. So that's tricky. But anyway, I'm not sure I see an easy way to get ourselves to agreement on priorities. So I just invite that. And then my final thing was, again, from Ms. Dean's comment, that again, if I'm understanding it correctly, it suggests that even at the high end of what we're recommending, we're not close to where we should be on the ELL spending bump. And it gives me a fact that I had not heard before, which is that we are the 6th worst of all the states for EL graduation rates and 3rd worst of all the states with measurable data for 8th grade reading scores on NAEP. And if that's so, and that our funding is drastically less, if I understood correctly, that our funding bump for ELL students is drastically less than other states. So if that's so, others are spending more and getting better outcomes. Are we ambitious enough in our L recommendations?
If I can make a comment on the EL recommendations piece. Certainly, there's room for growth there, and that there's room for growth left in your prescription. I think the bigger issue to press there as we move forward will be to get the methodology that you set out. because they did an overall ratio, but the board actually wanted to see it targeted based on student level. And so there's certainly a case for that. Just on the priority piece for a moment, recent history would suggest that the General Assembly is willing to take on SOQs in an incremental way. Now, if there's money to do them all, that would be great. But if there's not money to do them all, I think the board letting them know which ones you would prefer is important.
Right.
And that's because they may
No,
take
and
on an SOQ that's,
But that's a kind of that's really that's a sort of process or politics question. And even though the General Assembly may only act in an incremental way, do we best serve our mandated role by going as big as we think the need requires, with remembering President Gecker's admonition that we're setting base levels, not high quality or top levels. But with that admonition in mind, maybe we most serve a useful purpose in the conversation by going as far as we think the need demands, and then let them figure out what compromises they have to make with in the reality of funding.
I will say, Ann, that position certainly was mine last year and the year before. But as sort of having been through the process now a few times, and we certainly have resisted as a board, sort of picking the favorites. But it is, I think, clear that some of the things we want to do will have more impact on more children than other things we want to do. So I don't view it right now as a case of picking, one child over another. I mean, take, the work-based coordinators. Is it an important issue for us? Yes.
Right.
Will it drive the needle in the same way that teacher reallocation will, or teacher mentorship will? No. I know the cost is a lot less too, although we're adding another $6 million or so to the cost. It looks like
But is
doing
it
it this way.
but is it right to think? I'm sorry. Go ahead.
No,
I'm sorry.
I am, I think, prepared to come around to the idea that we can talk about these in terms of what we think the anticipated outcomes will be. And, what I think we have seen is if the assembly picks off a few, or the executive branch picks off a few of the easier ones to do, and then says, well, look, you guys got to win here, but yet the needle of achievement isn't moved in the same way on what they've done as it could be if, again, for example, we instituted a decent teacher, leader, and mentor program. I'm not sure that we have accomplished what we're seeking to accomplish. And, we allow folks to have sort of the moral high ground of saying, look, we did what they wanted, or we did a portion of what they wanted. But really, from my perspective, still, our goal is to, facilitate spending the dollars in the way in which we get the biggest possible positive impact on our kids. And, like I said, I wasn't here 2 years ago. I mean, you heard me say, the SOQs are like my kids. We don't pick favorites. Well, I think I'm prepared to pick favorites of my kids in order to, in order to achieve a different result than we've been able to. And frankly, then you can see coming through, you give them this list, you might get work-based coordinators, right? It'll be popular with the, every governor of candidates for jobs. It'll be a popular thing to do, every party's for jobs. And yet, in terms of what this board saw as the issues in the public school system, the large gaps, for example, and the misallocation of teaching talent, it won't change it. It won't change what we think is most important. Another kid's not going to be able to read if we do it, or if that is the end result of this. And so, obviously, and I think, everybody who's been on the board long enough knows I will never speak publicly or privately even a position that the board hasn't actually taken. And so if the board's direction is we're going to treat them all the same, that's what we will do. I mean, I'm not going to go and speak for the board other ways. On the other hand, it is now my advice to the board, and my position for the board, that we begin to be more forceful about those things that are going to make a real difference in the lives of our children. Yes.
I think in light of the pandemic especially, I'm probably more inclined to take that perspective, because I feel like the lasting effects of that will demand that there's some targeted support being brought to bear to address what students need. And I recollect conversations we've had in this respect in the past, and I actually appreciate Ms. Holton's reflection on our duties and what we need to make sure people understand about meeting our obligation as a board and what we're expected to do. But I am very much concerned about the protracted nature of what we're contending with. And I feel like identifying some good places to start, if there's got to be some guidance given from a policy perspective to the legislature, certainly is something that I would definitely support.
No, I'm sorry. Yes.
In the last month, I've had the pleasure to serve on a committee with Mr. Swan to discuss some issues that we feel like that are very important for all of the children and across the Commonwealth, and to follow up with, to add to what Dr. Mann was saying. And Mr. Swan, you jump in and help me with this too. Along the same lines of doing what we feel like will impact every single child in our great state is taking a look at the specialized student support positions, and taking a look at how many schools actually have registered nurses or nurses serving the medical needs of the students in every building. That to me is a very critical point right now, coming through this pandemic and moving forward with other issues that we may have. Our schools who are more economically challenged in our communities may not hit that to 1 per 250 ratio for school counselors, but the acuity of need in that school may be so great that more than one counselor might be needed for a 200 student school. Or a school nurse might not be needed in another school, but in our higher poverty schools, it's most important to look at the acuity of need per building in our disadvantaged situations. So that's something moving forward that I would like for us to have a conversation about on the board, maybe not this cycle, but in future reference, looking at the acuity of need in our neighborhoods and in our communities and providing the services for the children, because we all know that if they're not physically well or mentally well, that everything else falls to the wayside as much too. So just another thought to add to the mix.
Yeah, Mr. Swan and Dr. Duran.
Yes, I was just wondering why the ratio of school counselors was amended, seeing that we are in a pandemic and there's a lot more student need, because students are just dealing with a lot of trauma now compared to what they were dealing with. So I would be inclined to why that changed.
Mr. Swan, I think that the recommendation from staff is to maintain the prescription for 1 to 250, given that that is the recommendation of the American Counseling Association. It is the change that has occurred is due to legislation that partially implemented that recommendation to get to the 1 to 325 that goes into effect this school year. But that our recommendation, for the reasons you all have cited, would be to maintain that gold bar of 1 to 250.
Dr. Duran, yeah.
Thank you, Ms. Holton, for bringing up again the EL, and Dr. Lane for mentioning it again. I want to strongly encourage us to continue to double down on that need to really have a look at, by WIDA level, the funding that goes for EL students. Look at the data, look at the data, look at the data. We have 45% of our level 1 and 2 of our English learners across Virginia are level 1 and 2. That group of students graduates 20 points lower than the rest of the state. Their reading is 35% proficient versus 78 at the state. Their math is 51 versus 82. The data is clear there that the level 1 and level 2 students need additional supports. Many, Ms. Holton referenced, and maybe I think was in a comment, public comment, other states have been moving towards that, really understanding, and we've done a lot of great work here. So I want to remind everyone that we've been working on this, particularly around SLIFE and identifying that and putting resources there. So I really hope that we'll double down, emphasize even further. I know that there was progress made in the last General Assembly action with regards to additional funding and support, but they did not yet differentiate it in the way that needs to be differentiated. So I don't know how we can reemphasize with some of the data, just really, really telling the story is not just an idea we have, it's actually data that shows and practices that we see in other states and progress that they're making when they are differentiating in that way. So I really want to make sure that we continue. I don't know the best way to do that, whether it's adding more language in here, Dr. Sale. I don't know if it's adding more language, Dr. Lane, or if it's just how we educate more and more. I think it's something that we have to be louder about.
All right, I know you asked us for decisions. Okay. I will tell you that personally, with regard to the calculation methodology, I think I've become indifferent. I don't know if there's a strong feeling on the part of the board, whether staff's suggestion is, better or worse, but is there any, let's go to that first, is on the calculation methodology.
So I do have. So I asked the question rhetorically
Yeah.
before and saying maybe, at any point, but I would like to understand if you all, as you work to get to this recommendation, if you identified any unintended consequences, because I think that's what the conversation has been about. So if you would enlighten us, that would be great.
I'll just mention one and turn it over to the team for others. But the main, I don't know that it's unintended. I would say it's a known concern, and that is the fact that some school divisions will receive less funding, but based on their enrollment.
I would say that reflects the staff conversation well, that it's a known concern, and it has pros and cons, and it is perhaps, an academic recommendation to stay true to what will in the long term reflect the need, but that has real world implications in both directions in the short term.
So if I could just, of course, we know that is a downside. As I've thought about it and thinking of the needs that we have across the Commonwealth, certainly, but recognizing that many of our school divisions which have the highest needs are those divisions which tend to lose students in situations of crisis. And so, taking that unintended consequence to the next step, the next level, yes. If you have fewer students, the calculation would suggest you don't have as many dollars, but I would suggest that perhaps it is in those very divisions, some of those very divisions, where even in the short term, COVID related, whatever the crisis may be, and the enrollments are down, because parents can make other choices, those students who remain will have fewer resources potentially to serve them. So that is my concern, and just an observation. And if I'm not quite understanding that as fully as I should, please help me get to a better place.
I think you're understanding it, but I would also say that those school divisions that are growing are also growing in number of students in poverty, and they would receive less funding and then would not be able to have as many targeted resources. What I would, thinking purely from like a budget manager perspective, you're essentially having to make a decision to essentially lose 1 year's worth of decline versus every 2 years having to face budgeting for 2 years worth of decline, because it'll reset either way.
So if I may, I don't understand it, and I'm not going to, I don't think. So I'm pretty much ready to follow staff's wisdom on it. But I did want to point out, if I'm looking correctly now back at your slide, Leslie, the overall impact is actually pretty small. So, and that, could mean some divisions are losing more than that and some are gaining. But if the overall impact is that small, my guess is when if these other changes, if some of these other bigger changes are accepted, then it may net out so that nobody actually loses net dollars. We don't really know that, but
Yeah.
and it is also absolutely the case. The General Assembly's recent history has been to figure out ways to hold harmless, or at least a little bit, to moderate the changes over time.
And that was our thinking, is that the policy decision isn't so much whether you should do the decline in the first year or at re-benchmarking. The policy decision the General Assembly typically makes is whether to hold them harmless or not. And this would be something that could be subject to that.
Okay, you had the reading specialist issue. I know there's no conclusion to that, but that's okay for the moment. I mean, we don't have to make that decision today, as long as, or do you think we have to make this decision today?
The process from here is that we'll bring prescriptions to the full board, even though you were a committee of the full board, in October. And
Right.
so understanding at least what you want us to bring you then would be helpful.
I think bring the alternatives. I mean, you already have the second piece drafted.
Correct. The language that we
And
recommend
so-
is what's in that
Exactly.
particular slide, with
So-
that one sentence added on, and it is a may, though that comes with risks.
Exactly. So bring both of those, Francisco.
No, I was just going to say that if I heard Dr. Lane correctly, that this is helping divisions be more flexible, right? And it's not requiring one versus another. Is that what I heard you say correctly?
I think that's
So I
right.
think the more we can have more flexible options, I was pause for a moment, like Dr. Wilson did, about the notion of but when I heard what you said, I was more open to it because of the understanding that it's flexible, and there are some school divisions that this would help them be able to implement their literacy program, as long as we understood. Thank you, Dr. Wilson, for making the comments that were in my head.
We're now
too.
on the reading specialist, I take it. Okay.
Yes.
Any other thoughts on that?
I'm glad to see the amendment in there for the reading specialist. I think that makes this presentation very, very powerful. And I, for the record, support what the staff's recommendations are.
Okay. What else do we need to address? Work-based learning coordinators?
So I heard Dr. Mann endorsing the staff's recommendation on work-based learning, and I would certainly agree with that, and with Dr. Robertson's on the reading specialist, and my own on the counselors versus specialized student support. In all of those categories, I would support what staff's recommending. The only thing I wonder whether it would be profitable, whether we have further discussion to have, is on whether to do priorities or not, and I don't know how
We can-
easy answer on that.
Yeah, we can have priority discussion next meeting too.
Mr. President, my comment may not have been artful enough. I was wanting to indicate that I supported all of the staff's recommendations as presented.
Okay.
Thank you.
Anybody else on staff's recs other than, I will say I'm not quite personally, although if the board is, I guess we are prepared on the work-based learning coordinators. As I remember the discussion when we first did it, staff was arguing that the smaller jurisdictions really didn't have need for a full-time staff member. And that, basically because, as, James mentioned before, the industry may not, or the jobs may not be in one, but may be in another.
Yeah.
Going the coordinated regional approach with the deft hand of the State Department would be the appropriate way for us to go. And, you look at even pairings of smaller divisions together. Won't name any because I don't want to, but we debated this to now, whether it's just staff acquired more knowledge, or divisions have said, gee, we want this money to, create basically a $6 million, give or take, recommend for something, which, as I said, when we did the Perkins plan, it was, geez, the state can handle this better because this is better done on a regional basis.
And I
Which
will
is not to say, by the way, that if something's changed, I'm happy to support where we're going, but I'd like to understand better what happened between then and now.
And if I may weigh in, I was one of the proponents for more work-based learning positions and money.
Yes.
But staff did make a persuasive argument to me that in terms of individual school level, maybe we're better off supporting our overall counseling recommendations and student support, specialized student support positions, because those relieve some of the burden on the counselors, and the counselors can be doing work-based learning.
So I guess if you don't mind,
Yeah.
bring that back with both, okay? That language is drafted also, I take it. And so it shouldn't be an additional burden to y'all to bring it back.
And Mr. President, can I ask, while I'm supporting everything the staff is recommending, I would love to also see more response to both ELL and
Yep.
enhancing the equity fund. We be upping the percentages on either or both of those? And/or is there a way we can fold in Dr. Duran's recommendation around level, adjusting the ELL by level?
That's in your recommendation. It just was not adopted by the General Assembly.
So that's our,
Yeah.
oh,
It's
okay,
in.
good. So we don't have to add that,
No, I was
but
just
we may
finding-
need to add the overall, increase the amount.
More about it being a priority, that the policy is probably as big a priority as the dollars.
Yeah, and my comment, Ms. Holden, was that it's there, but is there any way to enhance it or make it
Sure.
stronger, or
And we'll,
some additional language or some way to move it to a more prominent?
and I know you have another topic, but I'll make one comment on priority, and if you don't want to handle it, I totally understand. We submit our priorities for the governor's budget by October 1. And so if you don't provide us any advice, we will make our own recommendations.
Okay.
Well, I think what we've heard many of us say, I think with regards to COVID pandemic, the supports that are needed for students, the support services, some of the instructional needs of our students, as I was referring to ELL, some of our literacy. I think that's something that I've heard all of us in one way, shape, or another. I'm assuming you'll probably have very similar priorities there, but I think what we've talked about from many, many meetings that I've heard from our board is really around that social emotional supports for our students, dealing with the crisis, mental health crisis, and then our instructional learners who are needing that specialized attention, whether EL, special students with disabilities, et cetera. Probably not a whole lot different than what your priorities are, but I would want to speak on behalf of the board, but that's something, themes I've heard over and over again in all of our conversations. And I welcome other colleagues to chime in on that, but that's something I hear over and over from all of us.
And as for that October 1 date, I'll just make one clarification. That is, we will make our priority decisions in alignment with the secretary, but I would want to be able to tell him where you are, because we try to always be on the same page.
So remind us what page your proposed priority list is on. Slide back up.
Yeah, well, and it's because of the number of prescriptions, we have it broken into 3, but the way that we have them ordered here, these would be the top 3 as we discussed, and then from there, we tried our best to organize based on feedback we have from you all, and of course, progress already been made. So I can click through slowly so you can kind of digest and reflect. These would be the top 3.
I have a question.
Oh, sure.
So based on the discussion today concerning work-based learning, is there any reason why it's only 3, or any reason why is it okay for us not to make the work-based learning one a priority now based on your proposal today?
Yeah.
And again, is there any reason why there's just 3 or constraints?
We were thinking about, the staff thinks about it in context of available resources. We don't know a number. We're not targeting a number, but we're somewhat making predictions of what we think could be likely. And so we wanted to have kind of a top tier, a mid tier, and a next tier. I've heard very clearly from Dr. Durant, he'd like to see us move the EL up piece. We had that in the 3rd tier, and I'll tell you why. Not because we didn't see it as important, but the reason it's on the 3rd page is there had already been some action there, and so there had been funding. But hearing that that's not a place where you want to stop, we can certainly think through that. And again, this is not reflective of what staff is intending to put forward, because we have not had our conversation with the secretary.
So can you flip through the next 2 pages for us?
Yes, absolutely. And as Dr. Lane mentioned, this slide reflects those spaces where we haven't seen the same gains we have seen on some of the other proposals, hence why we organized it the way that we did. But of course, just trying to do our best to synthesize the feedback that we've gotten from the board and reflect on where we are and where we've been.
Yep. And then the third one?
Mhm.
And the 15 million on English learners, that's the piece of it that wasn't yet done?
Yes,
Yeah.
that's the remaining. There's still a small delta in the number of staffing, and then it doesn't account for the different ratios based on proficiency level.
And then likewise on the specialized student support, the 48 million is the estimate of what they didn't yet accomplish.
Yes, that's the remaining one position.
Well, so I would be in support of moving the ELL up in the priority list. But I would also, to me, the assistant principal, we haven't talked about it in a long time because it's been in our recommendations for all, it's just been there, and it hasn't, because it's been, the need was recognized so long ago, we haven't talked about it. But am I not right that all the schools are hiring them and paying for them? And so it's not glamorous, but it sure is a big need. And so I'd hate to, if we asked the field, that one might be one that they would put in a higher priority.
They may, especially right now, because even though the Department of Health is responsible for contact tracing, we're aware that a lot of assistant principals are having to do contact tracing support. So certainly that would be one, I think, in the immediate near term would be a huge need.
I would submit, in addition, though, that having every school staffed with a full-time principal, let maybe start with that. So I, just think, kind of, there's a case to be made for all, as we know, for each of them, and thinking about prioritization if we are.
I would like us to.
Not a principal, that's right. That's right.
Yeah, I would like us to think about the world sort of in, what's been necessitated by, the COVID crisis, or the COVID situation. And, and if we get back to normal operations, what it is this board is saying ought to be done for the system as a whole. Our recommendations were system as a whole pre-COVID. There's a lot of money apparently floating around from the feds for sort of COVID stuff, which would include how do you hire people to do contact tracing and the social emotional needs, et cetera, et cetera. What I would hate to have happen is we essentially move things that ought to be federal COVID funded up and replace, if you will, things that we consider to be ongoing operational needs. The way a lot of this list got done, if you recall, was after the 2 years of the work program and listening to a lot of speakers. The two things that impacted kids the most, were teachers first, and then, building leadership, if you look at how we're going to change achievement. And so which is not, by the way, this is not about, English learners yet. We'll get there in a second. The thrust, not the whole goal, but the largest thrust of what we said was, if we change who's teaching the kids, all right, because we know that in poor jurisdictions, you have a preponderance of, or a significant increase in either inexperienced teachers or teachers teaching outside their endorsed area. We're going to change outcome. And I recognize that that's in the normal operational cycle of a school, not necessarily the world we're living in today. But as we push for, sort of permanent change in the assembly's thought process, it would be my goal personally to push for things that assume that we're going to get back to the way we were doing business, have kids back in school, have things running the way they're supposed to run, and use the federal money, use the recovery money for those things that fill the gap between where we are today and where we think the stable system is. And so when we talk about prioritizing and, the social emotional, which obviously I agree with, but I'm not sure I agree that the source of funding for that ought to be, through our priority list. To me, our priority list is how do we improve outcomes? And the way we improve outcomes is we're going to either put more experienced teachers in front of those kids. We're going to put teachers who are taught to teach better in front of those kids, right? And that's how we're going to do this. And we're going to provide, stability in the teaching force by putting a support system around teachers that has fewer of them leaving the profession early on. And, that's sort of the overarching concept of what we did when we first prescribed the SOQs. Secondarily, we recognize, and all the literature seems to recognize, that kids need to be reading on grade level at grade 3. Right? It's a predictor of a lot of things. The fall off occurs right after that. And so we promote the reading special, et cetera, to promote that standard as we go through this process. Again, from my perspective solely, that is where we ought to be as a board in terms of thrust. And I will add to that, Francisco, the EL, because of the significant percentage of our population who is now EL. And if we are going to enhance the lives of all of our children, we will get a large movement from spending money there. And so none of what I just said ought to be heard to say, I want to take money, that's not a high priority, because I think just by the sheer numbers, it has got to be a priority. Yes, ma'am.
So just a process suggestion. I hear you on why we should establish some priorities. Perhaps we can do that next month.
Sure.
Recognizing Dr. Lane's need to address the secretary by October 1st, but I would think that he could share the nature of the discussion today with the secretary, and then we may have input back from the secretary and other stakeholders that will help us make our decision next month.
I can assure you the secretary heard the same speech last year, and
Yeah.
Sooner or later, and I think he was an advocate for us.
Yeah.
But we need to break through past the secretary to the governor's budget in terms of the concepts. And as I said, the concepts I think we are promoting, evidence-based concepts we're promoting as a board are, we need to have more experienced, higher quality is not quite the right words to use, but teachers who are taught to teach better if they are lacking in certain portions of the teaching skill set. And we've talked as we move forward about linking professional development to teacher progress. We believe that the teacher mentorship program will assist teachers not only in becoming better at their craft, but also providing that support to bring them, to have them stay in the profession. The numbers I don't know anymore, but there was a time when we could have solved the teacher shortage by retention instead of new teachers, right? I mean, we may be past that now, honestly. I have not seen the post-COVID numbers, but the pre-COVID numbers were, if we improve the retention, and there's all evidence that mentorship programs of quality will improve retention. Bottom line of this is, and I didn't mean to hijack this quite so much, that we can get off on talking about where we are today with the COVID hole in the system. But I would, as I said, I think we are better served, and we are better serving our mission if we focus on what the stable system looks like. And we fill the hole with the emergency dollars, the sort of the one time, and I know time there are a couple of years, but basically the one-time money that's flowing down to fill that hole that we're seeing in the system today. So that's my pitch. And we can decide that one, I guess, at the next meeting. I think you guys know what you need to know. For 2 of them, we're bringing alternatives. For 1 of them, we're okay. We'll look at priorities again. It would help, honestly, next time through if we could have some of the EL data as to how many and graduation rates, et cetera, because I think that will go to prove the point of the need. And, one of the things we do try to do is back up our stuff with data. And is that okay with everybody? I'm not looking to short circuit this, but I know we've got some time constraints. We're good?
I think it would also be, President, helpful to just see what we've done in these areas, because I heard that comment as well, and a lot of time has passed, at least for the areas on the last slide that we've been talking about, where we said we've done some things and there are deltas there, and what those deltas, the delta obviously represents the number, but I would just be curious to understand that as well.
Okay, anybody else? If not, I guess we will wrap up this portion. And again, I mean this sincerely. I am so happy that so many people are thinking so constructively about what we're doing and how important this is. So I'm very grateful to all of you, and the staff as a whole for taking the time to do this meaningfully. it's really just, refreshing to me and gratifying. So thank you.
Absolutely. Happy to help.
Okay. Now I know, as all of you know, we're running, past the time for this committee, but what we're going to do is we're going to shortchange my work session instead of shortchanging Keisha. So the SOQ committee or SOA committee will meet fully, but Kent, you're on. Be mindful of the time if you don't mind.
Sure.
Thank you.
Good afternoon, President Gecker, members of the board, Dr. Lane. Mercifully, this is the short version of this presentation. You've been given access to the long version. Of course, Dr. Lane gave the longest version to the School Construction Commission over in the General Assembly that we've been supplying information on. But throughout the spring and summer, given your interest in this topic, we've been collecting data through various means from school divisions, surveys, building inventory, looking at secondary data and cost data. And then, of course, and I'll move through the slides pretty quickly here and leave some time at the end for VJ to give you an overview of the pending revision to the school facility guidelines, which really have been in operation for several decades and fulfills the obligation of the department and the board to provide guidelines and requirements for school facilities. And VJ will give you a quick overview of those latest revisions, which will be effective around October 1. Again, the presentation, variety of data points from multiple sources that we collected and analyzed over the spring and summer enrollment, of course. Limited availability of out-year enrollment projections from Weldon Cooper at UVA, which we used to rely on. These data here are self-reported 5-year projections, and of course, enrollment growth being associated with the need for new classroom space and new buildings, and you see those regions with the greatest projected growth out 5 years with an average growth of about 4%. Several of the more rural regions, of course, have static or even declining enrollment. While they may not need additional classroom space or buildings, they can have significant obsolete building space that significantly needs modernization or replacement just for their existing enrollment base. Number of buildings by type, of course, school divisions, over half of the types of buildings, as you know, and this relates to the spring and summer data that we collected to update school characteristics and conditions in another inventory, which had not been done in several years. Of course, one of the key findings consistent with previous findings are over half of the school buildings are greater than 50 years old, a significant age for most buildings in the Commonwealth, and that's fairly consistent across school building type. Given most buildings at the 20 or 25-year mark need some level of renovation in their life cycle, given that over half of the buildings are greater than 50 years old is significant in terms of the existing conditions of schools and the levels of state and local and federal support to improve them. Just a regional look at the age, the median age, about 52 years for the median school building statewide. Again, the more rural regions of the state, regions 6, 7, and 8, a bit higher than that, a median value age of 58, and with some variation across the regions. But about over 50 years for the typical building. And replacement costs for that base of school buildings. We applied some current industry square footage cost construction averages that we validated over the spring and summer time period, and an estimated replacement cost of those, end of life or near end of life buildings greater than 50 years, about $25 billion for a full replacement cost value based on current square footage costs. So a significant total replacement cost of buildings of that age. Some other quick industry or inventory findings: 3 or so of buildings are at or above or near capacity. About 20% of buildings need additional ADA compliance work, and that tends to be an ongoing capital and maintenance item for school divisions. And then about 15% of buildings have had renovation time period, and that's about 11-year fiscal year period. You see significant actual reported construction cost activity of over 100 new schools during that 10 or 11-year period at a total cost of over $4 billion, 568 renovation projects at about $3.3 billion. These are actual reported cost projects that are reported annually and certified by superintendents. Look at the magnitude over a 10-year period of the in terms of total cost and buildings involved. Another piece of data that we collected throughout the spring timeframe was analyzing over 5, 10, 15 years capital improvement program or plan projects by school division. And you see a quick ranking here of project type, whether new construction, renovation, additions, HVAC improvements. Roof repair and replacement is a sizable, critical type of activity to aged buildings when there aren't resources to necessarily replace them or full-scale renovations. But these are publicly planned CIP documented types of projects on a statewide basis. And then just a quick look at spending in the school facilities area, some operational and operations and maintenance area, which is critical for the health of ongoing health of buildings and lengthening useful life, and then more capital facilities and debt service costs, and these are reported audited costs from FY22 sections: facilities, capital, 1-year phase, spending bond proceeds, spending cash appropriations for construction and renovation. That's about $1 billion, and then of course ultimately most maintenance and capital spending that's recommended to be about 7% of the overall budget of Virginia divisions. Based on that benchmark, fall below that. And then in terms of ongoing operations and